We believe that high-quality oral health care should be available to whoever needs it, including patients with intellectual and developmental disabilities, older adults, and patients with complex medical conditions such as neurological diseases, cancer, cardiovascular diseases, HIV, and many more. However, this may be very challenging for the patients and the providers. The major barriers are the reimbursement, the lack of equipped facilities, and sometimes the lack of appropriate training.
The dentist looked at Tiffany. He said, "Tiffany can't open her mouth wide enough, I can't work with her." And that was it. And this was supposedly a special needs dentist. So the dentist showed up this time at the third appointment and examined her and said, "Okay, we'll accept her into the program. The waiting list is about 2 years long." I said, "You've got to be kidding me, a 2-year waiting list?"
After over 20 or 30 years of him going to that dentist, I guess I was sort of taken aback that they didn't really understand what was going on with him. And his teeth had really started to deteriorate. The dentist went on to tell me that he didn't see much of a bright future for my brother. He wasn't really a candidate for dentures, and that he would probably end up having all his teeth pulled out and having to just be reduced to gumming his food. He recommended that my brother seek out institutional dentistry, which we're still not sure what that means. They just said they were unable to care for him, and also added that their receptionist had seen my brother around town walking around. It looks like he had gotten out. I'm not sure what that means either, but my brother walks to the gym every morning and probably gets more exercise than most of us. I was kind of in panic mode also. It's like, what do I do now? Where do I take him for care?
Parents have told me that dentists don't understand. They don't have the knowledge of how to work with a kid who's nonverbal or a kid in a wheelchair who maybe has behavioral issues.
To treat these patients, providers need additional training and expertise. Together with the current reimbursement mechanisms, there is a shortage of providers taking care of these patients. The services are just not that available. And we see that because patients are traveling long distances from all areas of New York State, as well as surrounding states, to come here to our facility to seek treatment.
Our goal is to provide comprehensive dental care and to save as many teeth as we can for all our patients. Many patients, they come with fear and anxiety because of their past experience. Our job here in our clinic is to adapt our skills and to provide comforting environment to provide dental care.
They've been working hard to try to maintain his dental health. There's been a lot of follow-through, a lot of communication with me. The doctor has called me after his appointments with her assessment and what the treatment plan has been. So it's been kind of a dream come true for his dental health.
The dentists at Eastman, they talk to Tiffany. They don't talk to me about Tiffany. They actually talk to her. And I really like that. It's just knowing that she was in that pain and that she's not anymore is just a lot. That means a lot to me. So thank God we found the clinic.
Working side by side with medical team allow us to provide comprehensive care for our patient population.
So there's a lot of benefits to having dentists and physicians under one roof. I think the most important of that is not necessarily the clinical care, but it really is this approach and empathy of the entire team that's comprehensive. So care doesn't happen in a vacuum, right? We're one human being, we're one organism, mouth and the rest of the body, they're all connected. So from the patient's perspective, it doesn't make any sense for us to silo that care. And to have a different perspective on the patient limits our ability to leverage each other. We don't read each other's evidence. So it really gives an opportunity for us to collate that evidence, to make an approach to care that makes sense for the patient. In addition to that, we can bring that to the bedside for the patient. We can do that clinical care right at the moment that they need it, in the right fit, right time, right size for them, without them having to finagle the healthcare system. So if a patient comes in and needs support from their dental team for their oral health needs, and they have a medical concern at the same time, we have policies and protocols that allow our teams to interact in a way that's productive for that patient. So if we're concerned about a high blood sugar in a patient with diabetes, the dental team will access our nurse pool to check that blood sugar. And if there's persistent concern, the MDs will get involved to support that patient. So we do that for ventilated patients, patients on stretchers, patients with low muscle tone. We really try and come to the patient with what the patient needs and provide that resource at that moment.
Some of the examples we have are our air glide chairs, which are able to be moved to make access for wheelchairs. We have a new elevator that has specially been installed, which will enable stretchers and wheelchairs to be brought up to the clinic. The bariatric chair, which is a very specialized chair that has been brought into this clinic, allows for a patient to sit in the chair, but it also allows for a wheelchair to be attached and then tilt the wheelchair into a comfortable position for both the provider and the patient. And we have faculty who have the training and expertise to help with these patients.
I think the most important thing about our Smile Mobile is that we go to places where the population that we serve would not have been able to access dental care. We have a wheelchair lift that allows access to these patients very easily. We have 3 operatories, so we can provide care to 3 different patients at the same time. We have trained providers, and we also help our residents understand this population.
So the students at Mary Cariola range with their complex special needs. We have kids that are in wheelchairs, that are medically fragile. They may have a variety of medical needs, such as a trach, feeding tubes, nonverbal. And then we also have kids that maybe have autism, Down syndrome, and complex behavioral issues or rare genetic disorders. Maybe they were in pain and they couldn't communicate to us why they were in pain. So they're hitting themselves or picking at their face. The dentists at Eastman have that training along with our partnership, working with the dentist to understand how to communicate and how to work with the children. So the nice thing about the Smile Mobile and the provider on the unit is the no pressure approach with our students. So some kids might come onto the unit and they just walk in and say hi and they leave, and that's good because that's maybe all they can do that day. And then the next day maybe they'll sit in the chair. So the dentist is able to meet them where they're at, and that's part of a overall desensitization process. Jonathan recently had surgery and he has to maintain a prone position. So he's in his wagon throughout the day while he's at school. And the dentist is able to provide care outside the unit, in addition to speaking Spanish, which is his native language.
¡Qué bueno! Te veo ahorita, te veo la próxima, ¿sí?
The Eastman providers are kind, they're genuine, they're invested in our students. We've seen about 150 kids at Mary Cariola that are enrolled. We've definitely seen results with the kids. Some students, it may have taken 5 times for them to come onto the unit, and now they're coming onto the unit and allowing the dentist to at least look in their mouth, which is monumental compared to them sitting on the ground outside. The students building that relationship with the provider has been really nice to see them actually wanting to come into the unit and have someone to smile to.
We don't only treat patients with intellectual and developmental disabilities or with complex medical conditions. We also train the next generations of dentists and specialists to do so. They take the knowledge that they gain here and help others locally, nationally, and globally.
Treating patients with special needs make any dentist feel like he's as a special dentist. They ask me how, because I can tell, I feel every day the effect of being more happy, because it's very rewarding for me, and also I feel like the family, the patients themselves, they are really appreciative for our giving this service.
Our patients are really inspiration for me. I like to see them every day, and I like to see the progress that they make through every visit. That they come with dental fear, and then few visits later, they have a smile on their face. They are telling me their own personal stories, what they did through the day, and they are coming back to see me because they are happy to receive the care.
I'm really appreciative of what has been done here at the clinic because it has given me a great peace of mind. I don't have eyes on a situation when I'm 1,200 miles away.
I see students walking down the hallway and they smile at me and they say dentist, and they're so excited that the dentist is coming.
How does the dentist make you feel? Happy. Happy? Yeah.